welcome everybody. Good afternoon, good evening, wherever you are. Maybe even good morning in some parts of the world. Unfortunately, you cannot see me, but you see the more important ones, which is Samir and Ahlia, who are the celebrities of this webinar today. My name is Mosab Nasser. I'm the CEO of Federal Scientific, and it's really an honor for me to have this conversation today with Dr. Samir and Dr. Ahlia, who were with us in Gaza about 2 weeks ago. So the way I thought we conduct this one is different from the previous ones, is basically have it a form of conversation, because we want people to see basically with Samir and Ahlia's eyes Gaza and its true shape and form. And I would like to start first by welcoming everybody, and also welcome Dr. Samir and Dr. Ahlia. And I'd like them to introduce themselves. I'd like to keep this one maybe maximum an hour and a half max. I know previous ones took longer because there were a lot of questions. But if we can keep this one to an hour and a half, I think that would be great. Do we agree, Dr. Samir, Dr. Ahlia?
Yeah.
Agree.
Awesome, awesome. Again, I'm sorry you can't see me. I know it's kind of odd, but imagine you're speaking to a radio host. So I'd like you first to introduce yourselves to the people on the call, and in a few words tell us who you are. Samir.
Okay. So I'm Samir Khan. I don't know, they can see us, correct, Dr. Nasser?
Yes, they can see you.
I am a cardiac anesthesiologist and critical care doctor. I work in Southern California, and I'm married to Ahlia Kattan, who is also a physician specialist.
Yes, I'm Ahlia Kattan, born and raised in Southern California, also an anesthesiologist and ICU trained. I Samir and I spent almost 3 weeks in Gaza, and we got back about 2 weeks ago, and we really want to share the stories that we have from there. So we're happy for everyone to be here.
That is awesome. So when did you come back from Gaza? It's been
2 weeks ago.
It was Sunday night, 2 weeks ago.
Yeah.
2 weeks ago. Awesome, awesome. And you guys, you said you're married and you have how many kids?
We have 3 kids.
3 kids. And you left them back home and you just went to Gaza, correct?
Yeah.
Yeah, we have a 5-year-old daughter, 5.5, a 3.5-year-old son, and then our second son is 9 months old.
MashaAllah, that's awesome. May Allah subhanahu wa ta'ala bless them and make them among the righteous. Allahumma ameen. So I'd like to begin with the question, why Gaza? Why did you choose Gaza?
Okay, I'll take this one. I will say that Samir and I didn't want to go to Gaza. I mean, of course, we would love to go in different circumstances, but it was more something that we felt compelled to do, and felt something that we really couldn't live with ourselves, one, given the invitation and the option to go, to say no. We had been watching everything been going on in the news and on social media since October, and obviously we'd been following this from decades before. Samir and I have been to the West Bank, me twice before, Samir once before, together on a mission trip, and so watching everything happening and hearing about the need for physicians as we were watching the healthcare system collapse, and especially anesthesiologists, we're both felt like once that we had the opening to go, we really couldn't live with ourselves if we said no. If you ask me, if anyone knows me, they know that it's difficult for me to even go on what we call a date night. Leaving my kids is impossible. And I'm the type of person, when on my when I'm at work, I'm, staring at the Nest camera all day, chasing my kids around the house via a video camera. So going somewhere for, a few weeks without internet or being able to follow them and leaving them in the hands of, our parents, who with this without them wouldn't be possible, was not something I wanted to do, but we both felt compelled to do.
That's awesome. Again, may Allah subhanahu wa ta'ala bless your parents for agreeing to take this heavy job while you guys are literally in a war zone. So they are a blessing to have them in your lives. So when you were in Gaza, before we go there, did you expect ever you will make it to Gaza? Like when you thought we want to go, right? You went with Fajr Scientific, right? And you kind of stumbled through Fajr. Did you think that you will make it?
So Ali had found Fajr Scientific, and right up until we basically got, I mean, even when we'd flown into Cairo, I didn't even think we were going to make it. It's the situation is so unpredictable that you can be turned away at any moment. We were selected to go. We had spoken with some of the previous anesthesiologists that had gone. They had given us a heads up, and we had, done the best to mentally prepare for the trip. But there's only so much you can do mentally to prepare for a trip like this. The unpredictable nature of it was such that I think even when we were in Cairo, we didn't even know whether we would be able to cross the Rafah border into Gaza. A lot of that stuff can change last minute, as we witnessed on the return aspect of the trip. A lot of things were changed last minute.
Yeah, we had heard from the first mission that one of the doctors wasn't able to get in. And, this may be hearsay, but from, stuff that he had posted on social media. And so we knew that I heard a lot of doctors had been turned around. And so, to be honest, for me, I wasn't expecting to get in. And I realized that everyone wasn't expecting to get in, because as soon as we got across the border, I looked around and everyone was in kind of tears. And everyone, I could tell, and had goosebumps. They just couldn't believe that they had made it. And I think all of us were just in a go, go, go mode beforehand, like packing. And we had, amongst the 4 of us that came from Southern California, 5 total, but the 4 of us that were on our plane total from Southern California, we had 50 suitcases between us. So the week beforehand, we were packing medical supplies, clothing, and this is all from people who had donated stuff from our community, shoes for kids, medications that we had gotten for the operating room and outside the operating room. So we were in just like, our hearts were turned off and our brains were on, and we didn't really think it was going to happen. So when we crossed that border, we were both, everyone was kind of incredulous.
That's awesome. Yeah, just to clarify to those who are listening, the reason why the process is very uncertain is because you have to get approvals from multiple parties. One is the WHO first. They have to say yes, and then you get the approval of the local authorities in Gaza, and then you had to get the approval of the Israeli authorities to go in. So if any one of them says no, then you can't go in. But fortunately, in this case, we made it. We made it to Gaza, and this is you guys in Gaza, right?
Yeah.
You can see Samir is here and Ahlia is here. I just changed my pointer. So how did you feel at this point, honestly? Was it like a life-changing experience when you made it to Gaza?
I think at that point, I felt a little bit surprised, actually, because I was anticipating entering into a war zone, and I was really kind of just taken aback by how, I think the media exposure that I had prior to was very mixed. It's hard to realize what is true and what is not. And also part of the reason why I went was with Ahlia was to see what's happening on the ground and see what is actually occurring. When we were crossing from Egypt into Gaza, there at the Egyptian border, I think we were held for, I don't even know how many hours. I think it was like 4 or 5 hours just to kind of look through our bags, identify who we are. And then when we got into Gaza, it was like completely different. You know, these are people that like the US media has kind of like talked about as, you know, this is the enemy. This is we're at war against this. This is Israel-Hamas war. But we were welcomed and we were offered tea and water, and you know they carried our luggage. So it's funny because you see everyone's like the smiles are actually genuine in this picture. We were just kind of relieved to be in Gaza almost because like what we had kind of mentally prepared for was to enter a war zone, but then when we arrived, it was actually a very welcoming you know, civilian population.
Yeah, this photo is actually kind of emotional for me because I think that many of you know that here at this border entry, this sign has been destroyed by an Israeli tank when they took over the border crossing as a military base. And so looking at this photo is emotional for me. But I will say that when I look at this photo, I remember Sayed. Dr. Sayed is the one standing next to Dr. Osman with the baseball cap flipped around. He left his backpack there, and as you can imagine, all of us had really valuable things in our backpacks, including, you know, passports and, you know, battery packs, solar power battery packs, like a lot of valuable things, cash. And Dr. Sayed, when we got to our quote unquote safe house in Rafah, was like, I can't find my backpack. I left it at the border. And all of us were like, okay, your backpack's gone. Don't even try and look for that backpack. And then when the rest of the team came in 3 days later, they just, you know, went back to the border to pick up the team, and they found the backpack, and the backpack was in the hands of the people there who worked at the border, and everything was in the backpack. In fact, you know, they had looked through it for safety reasons, because any unattended baggage, you know, you should look through, and they wanted something from it, and they asked the doctor who picked it up, hey, can we have this? And that's the kind of people they are. You know, they don't just take things, and the backpack was still there despite being in a war zone where all of these people need these things. So those are the things that I think about, yeah, when I look at that picture.
Yeah. So how about this one, Dr. Ahlia? Do you remember what were you doing there?
Texting and walking.
That's actually the second day I believe we came to the hospital. This is, I believe, the second day we arrived at a European hospital. And yeah, tell us about this picture.
I think, you know, I have a smile on my face because I'm probably in shock that we made it. And we're walking through the perimeter of the hospital where many displaced people have set up tents, families, professionals, you know, physicians, nurses, and families who have been displaced from all over Gaza, because, you know, the assumption is, but obviously this assumption has been crushed, that hospitals are safe. But so a lot of people are there for the electricity, to be honest, and the water, and, you know, for the foreigners and the humanitarian aid that's coming through, because we bring candy, we bring chocolate. And so I probably had a smile on my face because I just ran into a bunch of kids who, you know, greeted me with so much love.
So let me ask you this question. I'm not sure, was it the Israeli defense minister who described Palestinians as human animals, right? What do you think about that expression? Maybe Samir.
Samir, take this.
This has been like an issue that I think has been like kind of said a lot in the US media, and I think it swayed a lot of like opinions of even people that I work with in the US. But you know, to me, when we arrived in Gaza, and Ali gave the example of what happened at the border, but there are countless examples of the humanity and hospitality and you know, spirituality, the level of community that they have been able to offer despite being in such desperate conditions. I haven't seen anything of this nature before in terms of such extreme levels of poverty in a war zone, uh, such an educated population that has been, you know, thrown out of their homes. Like, I mean, if you can imagine, I'm sure people are sitting at home right now. If you can imagine the clothes that you're wearing right now, these are the clothes that you'd be wearing for the next 8 months. You know, all your, 401ks and your, retirement savings, bank accounts, they're all wiped out. Your house is completely like demolished, and you're just on the streets with whatever you have like on your body. This is how they have been living for the last, 7 to 8 months.
Yeah.
And they're still able to provide us with such hospitality and humanity. So that term human animal is a very inaccurate term, and I'm not sure how that could even they could even be used in the circumstance to describe the Gazans.
Yep, I agree. I think if you really want to find humanity, you go to Gaza today. I think we've lived it, we've experienced it. The amazing spirit of the Palestinian people really continues to amaze everyone that walks the streets of Gaza. When we got to the hospital, Dr. Samir, remember, people were still living in the inside the hospital. They were cooking, making, baking bread and making their food in the corridors of the hospital. And this is actually one of the pictures taken from inside that later on, actually, they tried to clear it. And Failure Scientific actually helped in cleaning the hospital and tried to sanitize it afterwards.
Yeah.
I'd like Dr. Ahlia maybe to talk about those photos. I mean, I can tell you my experience seeing Dr. Ahlia in Gaza. She was, and of course is, continue to be an amazing doctor. But the thing that really struck me the most about you, Dr. Ahlia, is your humanity. You were, in fact, we kept calling you Mother Ahlia in Gaza. Because of the love you showed to the children of Gaza. You did not stop giving them things until the last minute we left Gaza. And this is something that I will continue to remember for as long as I live, that the way you treated them with love, with care, it's just beyond my imagination, honestly. So tell us what we were doing there.
Briefly, like I said, the only reason I would leave my children, and I know I'm not supposed to use political terms, but a genocide is happening. And when I look at these children and when I watch these photos of children dying without their parents, hungry without their parents, lacking education, and these are the things that I work so hard to provide for my kids, and I take for granted. And seeing these children without these things, without shoes, without education, without someone to hold them when they're crying in the emergency room, and then on top of it, being an anesthesiologist, when I had the option to go, I knew that I didn't have a choice but to try and go and see what would happen at the border. And so when I look at these photos, I think about how, if you imagine, if you have like a loved one, like your mom or your son or your daughter who has cancer, and you don't want them to have cancer, and you know that going there is not going to help stop the cancer, but you have to be with them because you love them, and that will help heal whatever hurting you're having inside regarding their cancer. That's how I would feel about how I would describe going there. There is a terrible, I don't even have the word for it, catastrophe happening to them. And to be there with them was an honor and a privilege. And it did more for me because I was able to be healed in a way, watching what's going on from afar by being there with them and being able to provide whatever little I was able to provide. And I will say all those things that I had for me were things from people had donated from all over the community. And we were just lucky to be able to convince Qatar Airways to take, $10,000 worth of luggage extra with us. So yeah, I will say that I'm the lucky one to have been there and to met these people, and to been able to fill a little bit of that huge gaping hole in my heart that I'm feeling watching now what's happening in Rafah and what's happening in the hospital. I don't know if everyone's aware, but the hospital that we're just at, we were hearing bombings, and we would hear the windows shake and the doors shake, but now and they were really close, and now they're even closer, and we're worried sick about them, and we're texting about all the kids that we know there and the nurses and the physicians that we know there, throughout the day, and asking about them. I don't know if you can still hear us, but we can't hear you, Mosab.
Yeah, I'm sorry, I was actually muted. I was saying, I'm not sure if you guys can see still the second picture that I put on.
We can
Yeah.
see, but I don't know about everyone else.
Yeah.
The mouse hovering.
Yes,
Yeah.
yes.
Perfect. Again, tell us about this picture, Samir and Ahlia. I see Samir smiling there with a bunch of nice kids. I remember this kid in Gaza. He was amazing, chasing us everywhere at the hospital, if you remember him, Samir.
Yeah, I think these pictures were taken when we were able to distribute food.
No, not him. He was at the hospital.
He was sorry, this one down here.
Yeah,
Sorry,
yeah.
I was looking at the lower. So there's a few pictures. I think it's yeah, that's down at the hospital too. We do have the picture on the bottom left is actually of girls that was in one of the tent communities where we were able to deliver some food on one of the days. I think it was on a Friday where we delivered food to the community. The other pictures I believe are at European Gaza Hospital, and there are a number of kids in these pictures that just bring joy to me, because they would always be willing to help out in any way possible. And for me, I'm not a native Arabic speaker, so I would rely a lot on these kids to direct me to where's the OR, where's the ICU, and they would always be available and willing to help out, and they were just so involved, just as like members of the community, and they were always energetic, and they were always just positive and excited, despite not eating food or not having new clothes or new toys or an iPad or whatever.
Or structure or routine.
Yeah.
Like as parents, we're always worried in the States about our kids having routine and structure and a snack. And, I would find these kids having ice for breakfast in the hallway. I'm not even joking. And then they would just greet us with a smile and be like, where can we take you? Because one of the photos earlier, you saw the tents that were made out of, those were tents in the hallways of the hospital. Because there were new hallways made out of tents, we were lost all the time. We didn't know where we were going. And the kids knew the intricacies of the hospital like the back of their hand because they were living there. So they would take us, we'd say, take me to the ICU. They take us to ICU. They would just wait outside the OR for us. Yeah, I'll let Samir take this. Sorry, I'm getting a phone call from work. Let me just take this.
No worries, no worries. So Samir, let me go to the next slide, which I would like you to talk about. You said this to me, this guy in the picture is one of the best surgeons I've ever worked with. Who is that?
Yeah. So this is Dr. Mohammed Tahir. He's a orthopedic nerve specialist in the UK and has done fellowship training in Brazil with one of the best there. This is actually a picture sorry, I'm pointing, but you guys don't know where I'm pointing. It's the left hand picture where he's doing an operation.
Can you explain to me what you're doing?
Oh, perfect.
Yes. Can you hear that? Can you hear the sound?
Yeah, that's I would actually ask Dr. Tahir in the middle of the case to explain what he's doing.
A very significant elbow injury. He's missing the whole proximal ulnar. No joints, been an X-fix for many months. The elbow is now enclosed. He's also got an ulnar nerve lesion. He's missing this whole medial ulnar side compartment of his forearm. So what we're doing is an opponent's polysis nerve transfer to the deep motor ulnar nerve branch. As far as I know, this is the first time in the world anyone's done it with the arm in this position. So This actual nerve transfer was described by my mentor and former boss, Dr. Jamie Bertelli from Florianopolis, Brazil. Valeu.
So I just want to make sure that the audience, the participants, can hear the sound, because I can't see their thumbs up. If they can give us some thumbs up, it would be great. I want to make sure they can hear the sound.
Yes, someone
Looks
just texted me that they can.
Okay,
So-
perfect.
Yeah,
So Dr. Tahir would explain, I would ask him what he's doing, because a lot of the procedures I hadn't done before. And he's a nerve specialist, and he was just absolutely phenomenal through and through, not just in terms of technical ability, but also his passion, his patient care, his mannerisms, his expectations, his goal setting, and was able to really, I think, perform I mean, we performed a lot of operations together, and we would work late into the night, and I told him right in the beginning, I said, if you're going to operate, I will provide your anesthesia. It doesn't matter how long, how late, we will get the job done together.
He was absolutely amazing. So this is another video of him. So we'll see a bunch of videos right now of him operating.
All right, Dr. Tahir, what do we have here?
We have, unfortunately, a 6-month-old fracture dislocation of an elbow that was fixed, unfortunately, in an incorrect way, and his radial head was out of joint. He also had a little bit of a non-union, so we've had to do an osteotomy of his ulna, release all the interosseous membrane, reduce the radial head. And now we've done that, as you can see here. So the radial head's back in joint. He initially had a segmental fracture of his ulna. This is a temporary KY.
So this is a bit graphic, so we're gonna stop there.
Yeah.
yeah.
So most of from an anesthesia perspective, most of those distal upper extremity procedures we were able to perform nerve blocks to provide anesthesia. But the anesthesia was not as straightforward as what we would experience here in the US in terms of, the limited supplies that we had. We would rely on regional, but also spinal procedures as well, to cover lower extremities. I think
You should probably tell them about, there wasn't, abdominal operations are operations we usually do under general anesthesia, but because the general anesthetic medications that we need are running out. And actually, just I was speaking with one of the anesthesiologists there right now, an hour ago, was telling me they have 0 medications. While we were there, we were really rationing our medications and deciding who would get what. And anytime we could do any sort of spinal, we would do it. And Samir did a spinal operation for an abdominal operation, a higher abdominal operation. We did a high spinal, which, these aren't things we normally do. And I will talk about a case right now about a 90-plus-year-old woman. She had her hip fractured, and she was waiting for an operation. And I chose to do a spinal on her, but I will say that most 90-year-olds who have had their hip fractured can't really sit up for a spinal. But, these are the type of people they are. They just, they sit up and they do it because that's what their physicians ask them to do. And so we got the spinal in, and because of the lack of resources, X-ray, the tools, everything to get any of these procedures done requires incredible creativity, ingenuity, because I would be watching and a tool would just break in half in the middle of the operation. So this is not how Gaza was before. This is just because of this catastrophe, this man-made catastrophe. And so, to get to the point, the operation normally takes, an hour and a half to, put a nail in someone's hip that's fractured, but it was taking 4+ hours because of all the complications of resources. And that's a very long time for a spinal, and her spinal was starting to wear off. And as her spinal was wearing off, she was not complaining. She was praying for me, and she was praising me. And she had the biggest smile on her face and was telling me stories about about her children and her grandchildren. And this is someone who's starting to feel a surgery, that her anesthetic is wearing off, like a real operation on her hip. you
So
know,
were you challenged, so Ahlia, were you challenged and Samir with finding anesthesia, or was it always available, but the quality was not great, or the effectiveness of it wasn't great?
I would say both, you know, in the emergency room, they would be texting us, hey, can you bring us down fentanyl? Can you bring us down ketamine? These are people who are coming in screaming in pain and don't have any pain medication. And so we would run down and bring it to them. We were running back and forth and in between the rooms, people would come in and be like, hey, do you have any more propofol? Do you have any more fentanyl? I mean, there was, and we brought a lot, but there's a lot of patients who need help. So there was a scarcity. And then in terms of the quality of things, you know, obviously, you know, there were donations of things. We brought the blood warmers that were, a lot of these are trauma patients who need blood. The blood warmers were not working. They were not affected. And giving cold blood is a huge risk for patients because it'll make them bleed more. It'll cause a lot of problems. And we were, Dr. Rahman, Shah Rahman, one of the British doctors, brought blood warmers. He was able to bring blood warmers for every single OR. So, you know, there were some things that we brought ourselves that increased the quality of care, including the medications and supplies, but there were other things that where our hands were just tied, you know.
So, you know, I try to avoid showing graphic pictures and images, even though the one we're showing are already graphic. But compared to the real graphic pictures, really, this is kind of nothing, okay? For example, I personally experienced in one of the situations in the ER where we had to crack the chest of the patient to do resuscitation, right? Because we couldn't do it from the outside. So the team had to crack the chest. This is something I never thought I would come across, but that's what I have seen. So I'd like to play the one to the left. It's already graphic, but let's see.
Can you explain what you're
Dr.
doing here?
Tahir talk
This is a
about
12-year-old girl, blast injury, multiple trauma. She has a open skull fracture, non-displaced, thank God, and obviously a massive wound that's full thickness on her face.
You could hear that one, right?
Yeah. So this is actually, so for those who don't know, to clarify, this is Dr. Adam Hamawi, who I also had the honor of working with. He's a plastic surgeon and actually a U.S. Army veteran as well.
And he was with Pama, to give Pama the credit for bringing him in. To be honest, it's good. He was really awesome.
To add on to that point, there were other teams that were there, and it was just, you know, everyone was able to work together and just kind of seamlessly. You know, our Fudger Scientific Anesthesia and surgical team members would work with the PAMA anesthesia critical care surgical team members, you know, pretty seamlessly because we all recognize that what the common goal is. But in this case, there was, you may not be able to see it in the video, but there's also another operation on this patient going on down by the extremity as well. So Dr. Adam Hamawi was operating on the skull, and there was another procedure going on below as well. Multiple times we would have multiple surgeons operating simultaneously for multiple injuries.
Yeah, you can imagine that multiple, you know, limbs are destroyed, or the brain needs to be operated on, the head needs to be operated on. And so for that reason, we often had, like Samir saying.
I think this video is Dr. Ahmed operating, if I'm not mistaken. Let's see if we can
So
play
we
that
just
one.
debrided all the foreign bodies from it because it was.
Okay, we have to maybe go back and see if I can play this one. No, it's not playing. So let's look at maybe this one to the left here. What do you see there, Samir? You remember this?
This was Dr. Tahir. We were actually down in the emergency department of the trauma bay. He's actually trying to remove a piece of shrapnel in a gentleman's hand or wrist. He's unable to, so we actually put the patient to the OR for further extensive debridement. He's got, you can kind of see how flimsy his arm is. The arm,
Yeah.
both bones in the arm were shattered, and he had to along with vascular surgery to fix the radial artery that was also lacerated in this patient. And I think I have him here in the middle picture.
Let's see if I can help these ones.
Near traumatic amputation.
He's doing the one in the middle here.
Die to all vitals.
this one in the middle, you have actually 5 surgeons operating. You've got Dr. Tahir and Dr. Hussein operating on the hand. On the left hand, you have that's Usman Shah, who was there, who was the critical care doctor who's going to be receiving this patient. You have Dr. Sayed Ahmed here operating on the leg, and then you have Dr. Al-Bashir and Dr. Al-Taji operating on the abdomen.
At 3 a.m.
Morning. My name is Dr. Ahlia Kattan. I am here with.
Trying to stop the other video, unfortunately.
I will tell you, yeah, I will tell you about the previous one, the one that you were about to play.
Yeah.
Not this one, but the other one. I'll just tell you everyone the story of that one. So as you guys can imagine, this is a hospital. This is a community hospital. So despite, I mean, other than being there for
Morning. My name is Dr. Ahlia Kattan. I am here with Fajr, a non-political humanitarian.
Sorry, guys, I have to do this.
Good morning. My name is Dr. Ahlia Kattan. I am here with Fajr, a non-political humanitarian organization, as an anesthesiologist and an intensivist providing care at European Gaza Hospital, EGH in Gaza near Khan Yunis. And I am now just walking to a case. I'll turn the camera around so that you can get a glimpse of the environment. The case is actually a young female who has breast cancer, and actually she is a candidate for localized lumpectomy with postoperative radiotherapy. However, here at EGH in Gaza, we don't have any options for radiotherapy, as many physicians have fled and there aren't the supplies. And as you know, these patients can die from these cancers if they aren't taken care of immediately. So instead, she has to receive a full mastectomy, which we are doing today. In terms of anesthesia supplies, you know, we don't really have propofol pumps or anything, and so we're squirting our propofol into these bottles here and to provide prevent nausea. And we were lucky enough to be able to pack a lot of suitcase filled with drugs like that prevent nausea and that help with pain. However, we weren't able to bring any narcotics. And as many of you in the United States know, we don't really want to use narcotics for these cases, so it works out fine. But for the trauma cases and the amputations and for all these innocent civilians that are suffering from pain from shrapnel and direct blast injuries, they're missing out on any pain control, as you can imagine, because now we are out of any narcotics here at EGH, and we're depending on any transfers or deliveries from field hospitals that are sponsored by outside countries. So here we are. Look forward to telling you about the next case. Take care.
Do you want to say more, Dr. Ali?
No, yeah. I was, just trying to bear witness as much as I could. Not much more to share there. I will tell you another story that is touched, since we're talking about medical things. I think, another case, maybe you could stop these videos.
Yeah.
So another case is, we had a patient who, as an anesthesiologist, we like to know, like, what is our patient's name? What is their age? What is their lab values? Their starting blood levels? Okay. I half the time didn't even know my patient's name. The nurse didn't know the patient's name. So for me to ask, their age or things that they don't know themselves, maybe because of delirium or the fact that they're passed out because they're bleeding to death, these are just things that we just dealt with, lack of information. One patient was a dialysis patient. She had kidney failure. And now at EGH, all kidney dialysis units were in service. They were not working. And so if anyone wanted to get dialysis, they had to be transferred to another hospital. To be transferred to another hospital is to go outside and, for lack of a better word, of a war zone, active war zone. So, these ambulances moving back and forth were very unsafe. So people going back and forth between hospitals is very rare. So this woman, elderly woman, was uremic. That was her uremia levels get very high. when you need dialysis, and so she was very much out of it and comatose, for lack of a better word. So I couldn't really ask her when was the last time she received dialysis. You know, there are no labs. I couldn't find out what her potassium levels are. Those are something we're concerned about and that are lethal when somebody's at dialysis. But the operation she needed was an X-fix removal. She had a crush injury from earlier in the war in her leg. And this is an elderly, innocent woman. And she's been lying in bed with this X-fix. These are these large metal rods that are there to stabilize a fracture to let it heal. And she needed it to be removed. You can't walk around with those. You need, you know, so she's been bed bound, and she'll be trapped in that bed. And you know, God forbid, if the hospital gets raided, she won't be able to escape. And so she needed those rods out, and the leg can't heal. They'll start to get infected in an environment that is lacking sanitation and lacking antibiotics. So for obvious reasons, she needed this out. So everyone wanted to cancel the operation because she hadn't had dialysis and she was clearly needed dialysis. But I kind of refused because I knew that if we just waited for dialysis, it would never happen and she would just rot and die on this bed. And so we had to be creative, and, you know, I didn't know anything about her. So I avoided general anesthesia because that's very high risk in somebody who needs dialysis. And we just, you know, to be honest, prayed and did as much local anesthesia as we could. And I gave very minimal medication IV. And we did a case that should be done under general anesthesia, just with local and a little bit of ID sedation. And, you know, I just want to talk about how alongside these cancer cases that are happening, these heart attacks, these chronic diseases that need to be treated, that, you know, there are lesser acute things, subacute things, chronic things that are happening in the setting of these traumas that are happening. And it's so hard to completely give you the entire picture of what's happening, but just a glimpse into how the entire structure has collapsed and how, you know, the conditions have caused the physicians and the nurses, everyone there, to have to step up a level in terms of their ingenuity and their creativity and their resourcefulness in treating these patients. And there are a lot of patients there that I'm surprised they're alive because of the lack of a system, a health
services. Yeah. So we've been talking for about almost 50 minutes or 45 minutes. What I'd like to do is move kind of to another segment away from the surgeries. I'm going to pass some of those videos and talk maybe about this patient here. Can you talk about this patient very quickly? Ahlia?
Yeah. This was, you know, I'll just use this example to talk about thermobaric bombs. Thermobaric bombs are the type of bombs that are being used there right now. They're bombs that cause a lot more heat, release a lot more heat than your standard bombs, and they do they suck out all the oxygen in everything and everyone around it. So patients that may look normal on the outside have completely collapsed and crushed lungs. And then the burns that we're seeing from these high level of heat from these bombs are you know, unbelievable. Seeing children, 4-year-olds, 12-year-olds, 9-year-olds, 8-year-olds. I think this child is about 7 or 8. You know, with the amount of burns all over their faces. And this is just what you see on the outside. On the inside, there's inhalational injury that causes swelling of the airway, and that can kill, obviously, someone if they survive the burns. So this child had their mouth and nose blown off, and the patch that's over the eye is the eye's been completely.
So Dr. Ali, if I'm not mistaken, this is the same patient, right? This one is the same
Yes,
as this.
that was the procedure. That's the before on the left, and then that's the after.
Yeah, I remember when he came out of the operating room, and I took this video of him, and you asked me to hear his breathing. Let's listen.
Yeah.
Yeah.
That's your hand.
Yeah, so I was wanted to lift up his chin because he's obstructing, and more than just obstructing, you can hear the wheezing. That's stridor. That means he's got a narrowed airway, and that narrowed airway is from burns and swelling in his airway. And And that is gonna get worse, or it got worse, and that could kill him. But, we don't have very many ICU beds, and leaving a patient intubated which is what he needed to recover from this inhalational injury. We couldn't afford that. So we had to extubate him and just pray that he survived and he would make it outside the window of the swelling.
Yeah.
So
Yeah.
yeah, that's just one small snippet of the medical obstacles that we came across there.
To kind of add to that, and also to kind of add to a previous talk by Dr. Usman Shah, a lot of these patients, when they remain intubated, they have to go to the ICU, and the risks of the ICU poses additional and very different risks to these patients as well. And one of the things that Dr. Usman Shah was able to identify was that some of the vents were colonized with Acinetobacter. So when you send a patient to the ICU, they basically you're risking them getting a further infection as well in many circumstances. And then also their immobilization, their inability to like move and heal. There's so many risks that you encounter there that you don't necessarily encounter here in the US. And you just have to weigh the risk benefit of a difficult airway, and if they can breathe on their own, then that would warrant an extubation in this circumstance, but maybe not in a typical community hospital in the US.
Yeah. Before we move on to kind of maybe more fun things, more happy things than talking about, the horrible things that we have seen, is there one patient that maybe still stuck in the back of your mind until today that you still have a hard time forgetting?
There was one patient that was in the trauma bay, and well, I mean, there's a lot of patients that I have now but there's one patient that really stands out in the trauma bay. When he came in, it must have been a 3 or 4 year old boy, right around the age of my son. Suffered like significant blast injury, and I remember Ahlia was taking care of him. She was at the head of the bed, and he was going to die. There's really nothing that we could have done to save him, and he was crying inconsolably. And then Ahlia, whispered something in his ear, and I asked her later what she whispered in his ear, but it was like this magical cloak came over him, and he became very, very calm. And then a few hours later, he ended up dying. And then I asked Ahlia what that was, and she said that she whispered a prayer in his ear. And I've never seen prayer work to treat pain that effectively in a dying child. And that's something that I've tried to untangle that in my mind and trying to figure that out. But there's a lot of patients that we had that, just memories will pop up as I'm going through the day, and treating other patients here, I'll just think of something else. And but that was one that I thought about today.
And Ahlia?
For me, I would want to talk about maybe the 18-month-old that came in with a bullet in her head that was lifeless and pale. She looked perfect, and none of us knew what was wrong with her. And we just were handed to her in the emergency room, and we put her on this bed, this gurney with no mattress and no sheet, and just started doing chest compressions because she had no pulse. And I don't know if you know how to do chest compressions on a child, but you hold them like this. And I've never done chest compressions on a real 18-month-old before. And I've never had to do that. And we didn't know why. And we gave up asking why these patients are coming in, but this one, someone said there's a bullet in her head. And then I saw the bullet entrance, and she was dead. It was obvious she was dead. But we kept on continuing to pretend to do chest compressions because we wanted the mom to know that we were still trying, and to give her time to process. And later I found out that the mom tried for 9 years to have this baby. And, you know, I could talk about that. I could talk about the guy who's my husband's age, who is a professional, who's got both of his hips crushed. He's got bilateral hips fractures. He's been laying in bed since the beginning of the war. He can't have any operation done. And he's going to die in that bed. I'm 100% sure if he's not dead now. And he wakes up every day in pain and doesn't know what his future holds other than agony and pain and death, and seeing his family just watch helplessly around him. I can go on and on with the patients that haunt my, you know, haunt my thoughts. And as I've gone back to work, looking at them and comparing to what I'm seeing in the hospital now here in the States, it's just, it's terrifying.
I mean,
Yeah.
for me, yeah, go ahead.
These are all, the thing is that these are all civilians. Like, we didn't encounter a single militant or combatant or even a police officer. These are all civilians that, you know, have goals, dreams, aspirations that we all have. And they are essentially being, you know, assaulted, like, with this like specific military operation. And, you know, these are educated individuals that are, they know what's going on. They know that, like, they can comprehend the extent of their injury and how devastating that will be on their future and their ability to achieve their dreams.
Yeah, for me, Samir was the boy with the tuna can. That was actually you know, what's his name, Mohammed Samour, that we visited, right?
We did that case with Dr. Tahir, and he had to amputate both legs and put it in a box, and that's
right.
Image.
He thought that effectively a mine that looked like a tuna can was food. He was hungry, looking for food, and he opened and exploded. Both his legs were amputated, and his left hand and 3 of his right hand fingers, or 2 of them actually, were also amputated. So yeah, let's move on a little bit. View of time, I'd like to allow for questions, but I'd like to quickly go over those videos. And also, Samir, you have filmed those yourself.
As we were wheeling to the operating room, we ran into, say your name for me.
Nazi.
Nazi.
Nazi is an anesthesia technician who I worked with.
Nazi knows Ibrahim. How do you know him?
Yes.
How do you know him? He is like your...
He's like my brother. My brother.
Your cousin.
Yes, he is my cousin.
We just found family
And
members.
we are very, very, very close friends. And I consider him as my brother.
His father is...
His father is my mother's brother.
Alhamdulillah.
I feel really bad because I would talk in English so frequently, and they're, you know, they're so polite, you know, they're native Arabic speakers, and sometimes I'd get so excited that I would just like converse in English, and they would respond, and you know, I would communicate with Google Translate a lot with the staff.
But I will interject and take this moment to say how educated they are. A lot of them are bilingual. A lot of them are, you know, reading textbooks and learning, listening to podcasts, medical podcasts, all in English. You know, all of the anesthesia techs that I worked with, these are technicians, these are not MDs, are knowing more anesthesia than many of my colleagues here in the States, because they're up to date, they're listening to podcasts, they're reading textbooks. So Samir didn't have any difficulty. You know, my Arabic, and especially my medical Arabic, is nowhere near perfect. We had no difficulty getting by there or communicating with people there from an anesthesia standpoint, and with our colleagues as well.
Yep. Yeah, let's listen to this video very quickly.
Zlatan Ibrahimovic.
Zlatan Ibrahimovic is your
That's the
favorite
fun
player.
part.
Yeah.
And before that?
For Zlatan,
Yes.
Paolo Maldini.
They're all Italian league. What about the English league?
English league, actually, still in Italian league, I like Daniele De Rossi. In Roma.
Yes.
Yeah. Let's go to English league. Our striker, Gerald. In Liverpool.
Gerard?
In Liverpool.
He is old. He is old.
And
Steven Gerrard, he was midfield.
Midfield. Nowadays, Jude Bellingham.
Jude Bellingham. Not Mohamed Salah.
No, بالكل
Bilkul Nay?
Time to work.
Not Mohammed Salah.
I need to do a
Ahlia keeping me in. That guy.
Boss,
And your favorite player?
My favorite player is Cristiano Ronaldo.
Cristiano Ronaldo.
Yes.
I hate Cristiano Ronaldo.
You like Lionel Messi?
No.
Seriously, Samir, let's go.
Okay, I'm going.
Come on.
The boss is rushing you
I was
forward.
running tight ship.
As we were wheeling to the
I ended up I ended up having a lot of conversations with the staff, and they were so wonderful, and kind of connecting with them in multiple different ways, multiple different levels. Actually, if you can go back, I wanted to touch on the third image that you had there.
So, Assalamu alaikum wa rahmatullahi wa barakatuh. As you see,
Yeah, this
this
is
is my
when
village.
the staff members went back home to
I live.
village
And
or
this is
town.
As you see,
this is actually really important for everyone to understand, is because a lot of the staff, just like our patient who found the can of tuna, would go back to their homes to find either diplomas or books, lost items,
Clothes. I
anything.
mean, certificates, like if you can imagine fleeing your home, all the things that you would want to take and not being able to. Everyone that we worked with just said, oh yeah, I just spent all night last night trying to get into like the tiniest crevice, that opening of their home, trying to find something for their kid or some diploma or something like that. These are details you don't really hear about or necessarily really can experience until you're there. And yeah, that was really heartbreaking for me, was hearing about my colleagues suffering like this. And people just like me and the first technician I met showed me the scars on his hand, on his wrists, from being detained and abducted, from the last hospital that he worked in by the IOF. A lot of these physicians, a lot of these nurses are moving down the line from hospital to hospital, just being displaced. First they were at Ashifa, then they went to Nasser, and then they were at EGH, and they're just waiting for the next siege. And hearing the personal stories, and the people I'm working next to, like the doctor will just say, oh yeah, my wife and son were martyred, and I'm here living with my daughter in the hospital, just like offhandedly. Or yeah, like these are the scars from me being abducted and tortured for 50 days. And this is why my head is shaved, or I mean, just like I said, offhanded in conversation. I don't know if people know, nearly almost 500 since mid-May healthcare workers have been murdered in the healthcare system. So, seeing physicians and nurses and besides the civilians that are dying, but the colleagues, part of it was very, very difficult, hearing how they're struggling. And, I will say Samir talked about a 4-year-old who died. He was the only one who was the surviving of his family, except his sister, who came in the emergency room. And then when he died, we took his sister to the operating room. She was 12. She had major crush injuries in her legs and burn injuries, and she needed to get operated on and debrided immediately. And we put her to sleep, and I couldn't wake her up. And I felt tired during those few weeks. I felt sad and depressed during those 3 weeks, but that was the first time I felt so desperate and broken that I couldn't wake her up. I said, she's the only one left in her family. I have to be able to wake her up. She needs to wake up. And I became desperate and panicked, and I felt my sympathetic system turn on. And this is me who had food, who had water, who'd been there for 3 weeks, who wasn't having to worry about a displaced family, who didn't have to worry about a paycheck, not getting a paycheck, who didn't have to worry about feeding my kids, who hadn't been there for 8 months experiencing this for patient after patient. I felt that extreme desperation in that moment. And I realized how weak I was. And they were there calmer and cleaner and just better at everything they were doing, and experiencing that 100 times over. So I don't know what brought me to that point was talking about how these people are going through their destruction and their destroyed homes, leaving their tents just to find.
Yeah. If you look at this video, this is one of the staff members went back to his neighborhood where he lived, and you can see how it looks like.
It's completely destroyed. And I think when you look at this, you see them going back to their homes, and they're looking for personal items, and maybe they'll in the patient that you remember so vividly, looking for a tuna can. Like if you come back to your home and you find some food, a kid opening that up, anticipating there'll be food, and then all of a sudden, it turns out to be a planted explosive. Like it's absolutely inhumane and unjust. Like that's not planted there to attack a militant or a combatant. It's planted there to attack a civilian or a child, and it's just absolutely ridiculous.
Yeah, I will say that, we looked at, before you get to the happy parts, I wanted to also talk about the displacement. We were lucky enough to be there with you, Dr. Mosab, a Ghazan yourself, and whose family there is being displaced, I think 2 times over. You helped them do that. And, I learned from details from nurses there who are actually also getting displaced, because we were there when the Rafah invasion started and people were being displaced who worked in the hospital, that it costs $2,000 or $3,000 to get a quality tent that can prevent the rain. If it can prevent the rain, it costs that much money to transport your stuff if you have stuff left over. And these people are without money. There's no municipal services or governmental services that are paying them. So, these are a lot of details that we're not really privy to over here, and that learning about them, I wanted people to understand the struggles that they're going through while working and trying to serve their community.
Yeah, just to put some numbers, Dr. Ahlia. For example, when we had to move from the safe house to the European hospital, which is about 15 minutes drive, maybe, we had to pay, I think, about $600. In Gaza, for example, this is equivalent you in, let's say, in Texas or California, moving from one place to the other and paying literally $6,000. Okay, that's relative to their income. For example, we used to pay $100 per gallon for gas, right? So inflation is extremely high, and the value of money diminished significantly, because really you can't really buy anything with that money, and you can't find the things you want to buy. And the idea that you can, when you leave your home, you expect someone is waiting for you with a nice tent. In Al-Mawasi, that's not really true. People have to go, and many of them go and buy, in fact, everyone today, because no tents are allowed in. Everyone go and buy their tents and pay $1,000, $2,000 to create any form of shelter for their families. So it's really heartbreaking. And on top of that, finding water. I mean, many of them send their kids to walk for 2 to 3 miles to find water for them. And, you're talking about a few gallons of water that will finish in a couple of hours, and you go back again and again. So it's things that you don't see quite often on the news unless you are on the ground. Driving, for example, in the west of Khan Yunis and Al-Mawasi, the trip that used to take you 10 minutes takes you almost 1.5 hours because of the densely populated area, what I call the tent town. Yeah, there's a lot to talk about. I mean, I'd like the participants in this call to send their questions, and I'm reading them. I'll get to them in a minute. I'd like to play this video at the end, and then follow it with a picture, and let Samir maybe talk about this one.
We created a makeshift soccer pitch for the kids one day when I learned that there's a lot of Real Madrid soccer fans there. And I mean, if you just look at this, like, clothes are clothes that these kids have been wearing for like 8 months. They still maintain them. They're like, they're just absolutely incredible. We were able to, the humanity here is like very hard to describe. And honestly, I'm like, it's very easy to get immersed in this society. Like when you get a sip of Gaza, you like thirst for more. And this is the reason why, because despite everything that's going on, despite what's been happening to them, they find joy, they find happiness, they find laughter in the soccer game, basically, and whatever you put together. They wanted to play with us, they wanted to participate and engage us and host us.
And of course, that tells you how important for them to play and have fun, right? Despite the war, the destruction, these kids want to play, and that's why I'm actually putting a graphic picture. So if you have any kids around you guys, please don't look, or if you cannot handle it, don't look. But this is how, when we talk about amputations, this is how we hand, the limbs to the people at the end of the day. Samir?
Yeah, it's one of the cases that we operated on
you know, this is a soccer player that you know, we had to operate on because of you know, and like this is hard for me to talk about actually, because this is so unfair.
I'll pass on that one. It's okay. I understand. Here we're looking at again how beautiful these kids are, that they chase you wherever you go at the hospital. Everyone says hi to you as soon as you see them. But interestingly, Ahlia had a birthday in Gaza. It's a good coincidence, right? And
I didn't want anyone to know, but they found
so basically what you see in this video is the
How can you not smile and laugh when you see that?
How are they the ones
like,
making us
they're the ones that
smile
were
and
like-
laugh? You know, when it's supposed to be like, they're the ones who greeted us and told us not to cry and were our strength, and you know, and we came there to be there for them.
But this is the
And-
contrast in emotions, right?
Yeah.
The previous slide, you were almost crying, right? And the next
Yeah.
slide, you were smiling. This is the Palestinian life. So basically,
Yeah.
you know, they know how to be happy in the middle of this hardship, which is really, really amazing. Okay. So
they're
yeah.
authentic and they care. Like if you notice there, they actually they gave a shout out to all three of our kids. They said, you know, Aya, Yusuf, Hamza, they remember. They're engaged.
To this day, they text me, they ask me, tell me about each of your kids. How are they? You know, yeah, I don't know how you get this kind of edeb or this kind of, you know, these manners in a war zone, but somehow it happens.
That's why Gaza is a beautiful place. This is, I'm going to end with this one and then we'll go to the questions. This is your favorite guy, right?
You got Dr. Hamawa, you got Tahir. Yeah, look at this. This is a good photo.
Yeah, so here we actually were going from the European hospital, if you remember, to the Al-Aqsa hospital. And on our way, we stopped at the beach and these guys went down and they gathered all these kids around them on the beach and they took this amazing picture. So let me go to the questions. You guys have done an awesome job so far, and we'll try to end in the next 15 minutes. If anyone has questions, please post them. I'm going to look at the questions that we have so far.
We have a lot of questions that we can see. I don't know.
Yeah,
if
I
you
see the questions here.
Oh, you see them too. Okay, got it.
Selective.
Yes, go ahead.
Yeah, we've talked about what patient or case was the most remarkable. I think we've talked about that thing. Talked about anesthesia medications.
So just to that person who asked about the anesthesia medications, I just got a text an hour ago that they don't have ketamine, they don't have midazolam, they don't have fentanyl, they don't have propofol. These are all medications we need as anesthesiologists. And we just heard that now that the border's closed, the only border that's open for people to go through, one doctor tried to bring in medications and he was turned around. And we're only allowed to have 2 suitcases now per doctor. So I don't know how they are going to get these medications.
Not even then. The news that I got this morning is that you're allowed 2 suitcases of your own belongings, like clothes, chains, whatever, but you're not allowed to any.
And you're not even allowed to have repeat of your own belongings. You know, only one thing of your own belonging. It's just.
Yeah, so the Rafah border is closed. Everything is going through Jordan right now, and the new restrictions are outrageous, basically. You can't really bring any medications.
Yeah, I know you're not allowed to bring opioids from the US.
Yeah, you can travel with those category 1 or 2.
And we tried to get them from Egypt, but we were not able to get them. And Egypt was also suffering a large vacuum or, because this has been going on for 8 months and doctors have been trying to bring in opioids from there. So they're actually suffering a lot from a lack of medical supplies and a shortage as well.
Yeah, another question here. I know you mentioned you guys could, bring supplies worth $10,000 in your luggage. Is this still possible post Rafah invasion? The answer is no, because the Rafah border is closed. Now everything goes through Jordan, and you cannot bring anything through Jordan, literally, except your own suitcases. I know this is a political organization, but politics is engraved into everything. I'm just wondering if people in Gaza have mentioned if the uprise in political tension in America has affected the intensity of the attacks by the occupation forces. In fact, yes, we've heard from, and we've witnessed actually, that the number of casualties were decreased in Gaza because of what's happening in the US. So there was like a kind of a positive impact on the people on the ground to a certain extent, but then it kind of went away. Do you guys see these questions?
Yeah, so I will go just to quickly about where we lived. So we didn't touch upon this, but going together in a war zone was obviously concerning for us. Samir made it very clear that from day one that he didn't want us sleeping in the same building. So Samir slept in the hospital. I slept in the quote unquote safe house. The safe house during the invasion became no longer safe. I remember Mosab, Dr. Nasser, in the middle of the night came to our room at 4 a.m. and they were on the guy's side and they said, "Are you okay?" And for me to see Dr. Nasser scared was a big deal, because he was teglegish. He was not worried the entire time. And he said, "Okay, we got to go." And that was the first time I saw worry on his face. That night, we were really feeling and seeing the explosions, and we knew we had to get out. So then we were in the same hospital, sleeping, but in different parts of the hospital. So that was our sleep arrangement.
Just to clarify, the sleep arrangement was not because I don't love my wife. I love her very much. It's because if a bomb were to strike, we had to be, if it would only kill one of us.
And we later found out that many of the Palestinians and the Gazans are all living this way. They're splitting up their families so that not everyone in the family is killed.
That's correct. Yeah. Do you know if urgent supplies are lacking and all are lacking and all hospitals completely out of anesthesia?
Yeah, like I said, the text I just got now from an EGH tech, when they had the most amount, they have nothing left, and they were getting it from field hospitals, which are now actually being evacuated. So the answer is they're if not out, they're close to being out.
I think the local anesthetics, but there's almost no narcotics. We ran out of fentanyl while we were there. We'd have to be creative with the local anesthesia and do high thoracic level spinals to cover abdominal procedures. But it's completely collapsed. They need just about everything you can think of.
Right. The question here, actually, for me, doctors and medical students that have evacuated to Egypt from Gaza are struggling and need help continuing work or studies, but impossible in Egypt. Do Federal Institute or Federal Scientific has any department of such to assist them? The answer is no. Our focus is really on surgeries, patients, kind of helping the people on the ground, and we feel for those students. I recommend that you reach to an organization called REACH, I believe REACH Education or REACH Foundation. They have been helping with that. And I maybe in the future we will look into a program as such. But for now, everything we have raised really was raised with the intention of treating people on the ground. Do you see any questions, Samir? And
the survival rate was incredibly low. That patient that we showed you that all 5 surgeons were operating on, he died a couple of days later in the ICU because we didn't have dialysis to treat his crush injuries on his kidneys.
He went to AKI.
A lot of these blast injuries, a lot of these major casualty traumas that came in, most of them died, over 75%. Do you think that you saw on the ground it was the same as social media? No, it wasn't. That was something that really overtook me, was the amount of destruction. It took my breath away. And we stayed mostly in the hospital, but going in the beginning, driving from Rafah to Khan Yunis and then driving to Khan Yunis out, and that was post the beginning of the invasion, and it's supposed to be the limited operation. All of us had our phones out taking videos with the destruction that we saw in Rafah that was kind of still standing prior. And that is something that I couldn't see or appreciate in the media, was the amount of destruction and despair and desperation that these they're humans are experiencing.
Is there anything that surprised
Yeah,
you?
there's a question here. Is there any sister organizations that we can reach out to along with yours for assistance with a child in critical condition? There are many organizations that assist with those cases. I think PCRF has done a great job in getting patients out. I think who else? I mean, again, what we assist with actually is primarily getting them out of Gaza to Egypt. And even then, to be honest with you, for those who are listening, I don't recommend it because many of them are not taken to specialized hospitals. So we try to minimize how much we take out of Gaza. In fact, we prefer to bring the doctors to Gaza rather than taking them out of Gaza. And that would be my recommendation. Any questions you see?
The things that surprise us about anesthesia, the thing that surprised me with the patients is when you are trapped under rubble for a week without food or water, and then they come in, you almost expect them to have, like, at the very least AKI or maybe even sepsis, particularly if they suffer from burns and crush injuries. A lot of these patients would come in and, like, they miraculously didn't have an AKI, or that miraculously weren't septic, but there's always a risk of wound infection. The thing that from specifically anesthetically, like, we didn't have to use much Versed. A lot of the patients, Ahlia, did you have to use Versed?
No, yeah, Samir pointed handed this to me because I
anxiety was
practice.
not an issue.
Yeah, anxiety in the hands of a foreign doctor who barely, could speak in their language. They just said, okay, and beforehand and before anesthesia in the States, we have to give people anti-anxiety medications, but we have this concept in Islam called yaqeen, which is kind of certainty. And I saw that in the Ghazan. They were just so certain that whatever was meant to be was meant to be, and they would just go to sleep in these conditions with little information about what was happening or how they were going to go to sleep or what operation was even happening to them, with no what we call Versed or an anti-anxiolytic. And then this question about the OR beds and fracture tables, etc. I will say, an interesting point here, another detail that you wouldn't appreciate unless you're there. So the way we transfer patients from bed to bed is with a sheet, and all of the sheets are being used for what? Tents, makeshift tents. There's no sheets to be found in the operating room, let alone mattresses, because everyone doesn't have a bed. So all the mattresses are now being used for displaced people. So patients are laying on wired beds. And in order for us to transfer them from one bed to another, we're making what we call a bridge with our arms, with one person on one side of the beds and the other person on the other side of the beds, reaching over and placing their hands under these patients. And that's precarious in itself for the patient and then also for the providers. So that's just one small aspect. In terms of sanitation, there wasn't soap by the hand washing stations. There was iodine. I got very used to iodine. I don't know how well it works, but that was what we used. Yeah.
In terms of, I wish I had a video of this. We had a patient who had a blast injury. He was in the ED, and we gave him ketamine to take out the particles from the blast, or I guess shrapnel, if you may. And we gave him ketamine, and what was absolutely mind-blowing to me is that once we gave it to him, they have such faith and such certainty in their faith that in that disinhibited state, he was praying. He was just, it was just prayer. Throughout the whole process of removing the shrapnel from his body, he was praying. And he stayed still for us. It was absolutely mind-blowing for me.
Mostly shift work or just work Work. We worked, this day at the beach, Samir and I did not, if you go to we were not at the beach.
I think that was
Yeah,
Tahir's one
there
day
was
off.
no anesthesiologist. I remember one day, this is the day of the beach. I came to work and I said, at noon, I'm gonna go with our, no, not the day of the beach, the day that people went to go feed at the tents. I went to the operating rooms. I said, I'm gonna leave around noon. And the one anesthesiologist who was there from the local, he said, why are you leaving? We need you. And I said, we're gonna go feed people. He said, no, you can't feed people. I said, okay, call my boss, call Dr. Mosab. And I said, I can't go. We didn't get, it was, and I know I'm not complaining. I'm only telling you this so you know what these people are experiencing here. They need help. They need relief. They're working 24/7 nonstop. And
10 months, for 8 months now.
yeah,
Great.
for 8 months now. So
So this is a question to Samir. How many Hamas militants did you operate on?
So we did not see a single militant combatant. Again, not even no one with any weapons, not a headband, an armband, nothing. To me, it was clear that this is just an all-out assault on a civilian population, like an educated, innocent civilian population. There was no, and I'll be honest, I walked around with Dr. Taji. We walked around at night. We would ask people questions, and alhamdulillah, his Arabic is very good. There is no Hamas there. I didn't see. Maybe there is, but we didn't see any in 3 weeks. I don't know where they are, but there's none that we operated on. We didn't see any.
I can tell you, Dr. Samir, what we saw. We saw not just civilians. We saw families brought to the ER.
Yeah.
In pieces. 3, 4 of them are dead. 3, 4 others in the state of death. A brother, a mother, a sister, a father. That's what we saw, really. And anything that says otherwise is not telling the truth. You have to be on the ground to see this. That when we say civilians, we actually mean entire families wiped out. Okay. So, who are the most in-demand specialists in this war condition? Maybe we can get the word out. We really need everything. Samir, you tell me.
Yeah, everything is necessary. I think in terms of surgery, anesthesia, those are like the big, I guess like popular things to focus on, because it's I guess there's more action around surgery and anesthesia, but they need family medicine. They need regular consult. They need food, water. They need people who can provide clean water. Any type of humanitarian effort is required and necessary in order for them to improve their condition.
Our pediatric interventional cardiologist, Dr. Badran, was very busy there. And if you couldn't think of a more specified field, ophthalmologists, the entire structure is collapsed. And all of these higher specialty people are the people you can imagine who are able to escape because they had the means. So a lot of these types of physicians are missing or gone. Like I told you, there are no radiotherapists there. So, these are everything. It's not a question of what specialty, everyone. Yeah.
Let's try to be quick, because we are almost 1.5 hours, and I promised to kind of keep it at 1.5 hours.
Sure.
So let's just go over the questions very quickly. Is it possible for U.S. government to deliver supplies on the makeshift bars that was set up? The answer is no. We have a mobile hospital that we would like to bring to Gaza. It's a 120-bed hospital, 8 operating rooms, 4 ICUs, and 4 post-op. And we actually asked if we can deliver through that, and the answer is we never get any answer. So the answer is no. So we have to go through the regular channels. My understanding is that has not been effective at all. It could be, but I haven't seen, and I have not seen feedback that it has been effective. And again, I question, why would you build something like this when you have 3 entry points to Gaza: Rafah, Kerem Abu Salim, or Kerem Shalom and Ares Crossing, and you have more than 10,000 trucks lined up outside Rafah? Why did you just open the border? Why do you have to be overly creative? So again, we'll pass on that one. who would take over with the post-operated child whose family is not there and the limbs have been amputated? It's a very good question. There are many people, look, the people of Gaza would never, again, no child is left behind. Someone will take over locally. And I'm not sure, personally at least, haven't seen or come across the residents adopting their children abroad or over to people overseas. Samir.
I want to touch that too, because you know, when you're there, it's so hard to describe this, but you are never left. You don't have to worry about not being like taken care of or hungry from the Gazans. They will do whatever it takes to make you feel comfortable, and they're so hospitable with whatever they have. It's a feeling like I've never experienced before, whether it like wherever I've traveled, you know, the level of hospitality and the level of support and community support. You know, there's a Haitian saying called, I guess, if there's enough for two, there's enough for three. In Gaza, I feel like if there's enough for one, there's enough for 10. They somehow manage, like I remember giving a protein bar to one of the staff members. They'd break it up into 6 pieces and eat together. Like no one would eat alone. The community and the support that they provide one another is something to aspire to.
Yeah. There's a question here, Samir. I'm from Pakistan. Are you getting medicines and food from Pakistan? Look, I can tell you so many organizations have sent supplies to Gaza. Most of it, a lot of it is stuck outside the border. What goes in is very little, unfortunately. I can tell you our experience. Walking the streets of Gaza today, you would think that there are no humanitarian organizations on the planet. Those people are like facing this reality on their own. And correct me if I'm wrong, Samir, not because these organizations are not doing their best, it's because very little goes in. And also the need is humongous. For example, the Fajr team was at the European hospital. If you go to North Gaza, or even if you go to the other side of Khan Yunis, and you ask them, have you seen the Fajr team there? They will tell you, no, we haven't, because the need is so huge. Almost every corner in Gaza needs help, whether it's with tents, with food, with water, with medicine, with doctors, with everything. So I'm not blaming anyone for delivering or not delivering supplies. The need is huge. The restrictions are very high. And irrespective of who can bring supplies in or cannot, but if you go and walk the streets of Gaza, let's say in Al-Mawasi, west of Khan Yunis, people are just managing on their own. You would think that there is nothing called humanitarian organizations on the planet. Let me just put it this way.
And this is one of the reasons why we went with Fajr too, is because we know that there's a lot of organizations out there that may want to donate supplies and try and get supplies into Gaza to help out, but Fajr Scientific has a track record of being successful in doing that and providing like not just supplies, but physicians, nurses, humanitarian aid workers, food. And, you know, I think it's important to also direct, you know, your focus in organizations that actually will work and be successful on the ground in Gaza. And I think that's one of the reasons why we joined Fajr Scientific, is that we knew and we were confident that this was able to be done successfully through Fajr Scientific. And we really appreciate you for that, Dr. Nasser. It's been, you know, an honor and a pleasure learning from you and working with you.
And it's really our honor to have you guys come with us. It's been an amazing journey, and inshallah we will continue this amazing effort together. A question about prosthetics, which is really important. A lot of people in Gaza of all ages need prostheses. If anyone, this is something that we will be offering. In fact, the child Muhammad Samour with the tuna can child who lost both legs, we promised to do prosthesis for him, but it takes a long time because he has to go multiple surgeries and cleanups and all that to be fitted with those prostheses. And we plan to do them here in the US and bring it to him back there. But if anyone would like to, bring him here and adopt him effectively for a few months until we put those on him, please reach out to us and we welcome that. Or if he can help donate those to him. We also
I also wanted to comment on the specificity of a lot of these injuries. A lot of these injuries will hit, large vessels like the femoral artery, the brachial artery, and require amputations at joints that would preclude, like, would essentially limit the effectiveness of prosthetics. But the ones that can get it, they absolutely need it. But to me, when I saw that the specificity of these wounds, they're targeting certain parts of the body to ensure disability. That is, that is very difficult to treat, if it is able to even be treated with prosthetic. And that's something that was, has, really affected me, kind of seeing such specificity in such wounds over and over and over again.
Let's look at this question, Samir, and I have seen this myself, Nicole. I saw it, I believe it was on Instagram. We take every comment, every feedback very seriously. I've seen the case of Sadil. Unfortunately, this is kind of not something that kind of within our expertise. Plus, the only thing we can do for her is really try to get her out of Gaza. Right now, we cannot bring medications to anyone after the closure of the Rafah border. The doctors effectively that enter, the physicians or the surgeons that enter Gaza through Jordan right now enter empty-handed. They carry their suitcases with their clothes, no medications. So even if we can bring the medications into this child, who I've seen in normal conditions or circumstances, which we do, we have something called the Fajr Free Pharmacy, where we provide a lot of medications to people who have left stranded in Gaza because there are no pharmacies in Gaza. Those who have diabetes, those have heart problems, and so on and so forth. We brought supplies or medications to over 350 patients in our last mission. At the moment, that has stopped because we cannot bring those medications in, and we cannot even take this child out because the Rafah border closed. So there's so much we can do, and there is a lot that we cannot do, unfortunately. So again, I apologize for not being helpful here with this case, and thank you for raising it up.
See. Thank you. We found a later.
Yeah, you've reached to a lot of hospitals. One of the things we try to do is really treat patients in Egypt. There are a lot of Palestinian children who have been injured, and we offered to actually treat those children in Egyptian hospitals. It never happened. I tried personally many times and trying to find creative ways to bring people like Samir and Ahlia and our surgeons to operate on them. The system doesn't allow it. In Jordan, it's also complicated, unfortunately. So we are left with either transfer them to be treated by the local doctors in those different countries, which they do, or we go in and help them locally, which actually would be my preference based on my experience. Yeah, thank you very much again, Shahzad. Have we found a way to get prosthetics to? Well, again, we can make them, prepare them outside, and then bring them with us to Gaza to the different patients. Can we access this webinar once it's done? I believe it's recorded. We will talk to our IT team to see if we can make it accessible to everybody. How is taking permission from Israelis to treat their destruction work? I'm not sure I understand the question, but at the moment, again, to rebuild, you need to get permission from all the parties involved. Thank you, Nicole. Again, I wish I was of a more help to this child. Are you allowed to send money? Not at this point, to my knowledge. My family is in Al Mawasi. Sending money right now is nearly impossible because there are no banks. So even those who've been working, by the way, in Gaza, for those who are not aware, some of them get their salaries, but it's just a number in the bank. You cannot go take it in a form of cash. So you're being paid whatever number of dollars, and you can't get it out. So even if you transfer money to your relatives in Gaza, they cannot get this money out of the bank, unfortunately. So yeah, the situation is very difficult. Someone asked the question, what can we do? Those are, for us, these are the kind of expertise we take, medical and non-medical. So you don't have to be a medical doctor or a nurse or a physician to volunteer with us. Fajr is basically a platform for those with talent to display their talent and help the people in need. We take everybody, as you know, again, but it's not, it's a very, very competitive. We don't take anybody, but we screen, we take the best of the best. So if you're part of Fajr, you are part of the elite, effectively, to join this amazing organization. And we want to keep that. If you would like to stay connected with us, this is our website, Facebook page, Instagram, and if you would like to donate, we appreciate that by helping the people on the ground. Things you can, call for action, demand a ceasefire, and I'll let you read those. This is really what we should all ask for, a ceasefire, because the people in Gaza are tired and exhausted for the past 8 months. With that, thank you very much, Samir and Ahlia, first and foremost, and thanks to everybody who listened to us for the past almost 1.5 hours. I hope you enjoyed it. You've learned something new, and inshallah, you will also volunteer with us in any capacity that you have. I will give Samir and Ahlia the last word before we close. You've been amazing as always.
Thank you, Dr. Nasser. It's just been an absolute honor to be able to work with you and with the Fajr organization. I think it's important to, as this slide that you're showing is to not just demand a ceasefire and demand stopping this like indiscriminate bombing and whatnot, but also to support to be able to mobilize and support the organizations that are able to get the job done. I think Fajr Scientific has been a phenomenal group, through donations, if you can't physically go yourself, through time, if you can't donate money, then giving your time to help out with, there's a whole slew of things that needs to be done, whether it's social media, getting the word out, you name it. But for us, this trip was very eye-opening, enlightening. It was, Ahlia had said that she was going to plan something really special for my 40th birthday, and I didn't know that it was going to be a trip to Gaza, but we managed to make it work, where we flew out on my birthday, and then she was able to celebrate her birthday in European Gaza Hospital, and looking back, these experiences are something that I'm very, very grateful for, just to have experienced what Gaza is like, and to be immersed in that community, to be humbled by that community.
That's amazing. And just for the record, we're planning another mission coming in about 10 days, sending a team to Gaza. And when we asked who was going to volunteer, surprisingly, Samir and Ahlia wanted to go back, and I said no. No, because I think it's time for you to take a break, spend time with your children, and inshallah you will be back soon in Gaza. So I want to give you the final word, Dr. Ahlia, before we close.
Please, nobody praise us or make this about us. This is about Gaza and everyone in Gaza, and the stories of the healthcare providers there and the innocent people there. And if you have any questions, please reach out to us. If we weren't able to answer any questions, please forgive us. And anything good that we said or good that we did, came from God and God alone. And then that's how we feel strongly. So please, the other thing is, if you feel like there's something you can't do, there is something you can do. Whatever you are good at, drawing, singing, apply whatever you're good at. I just happen to only have the skill of being a doctor, so that's why I went. But whatever you know how to do, apply that to Gaza. There is a way to do that. So, and to every humanitarian crisis happening, but yeah, I'm sorry, I'm tired. I'll let it stop talking.
No worries. You did a great job, Dr. Ahlia. Thank you very much. Thank you, Dr. Samir.
Take care.
Thanks everyone who took the time to listen to us, and stay tuned for the next one. I think it's coming in a few days. So keep watching our emails and our Instagram posts. Thank you very much, and you have a good evening, everybody.
Yes, you
Thank
too.
you.
Assalamu alaikum wa rahmatullahi wa barakatuh.